Good afternoon, folks, and Happy New Year from us at Ottawa Public Health Media Team. Bon après-midi tout le monde. On vous souhaite une bonne année de la part de l'équipe des médias de SPO. Thank you for joining us for today's media availability. Merci d'être parmi nous pour ce point de presse. My name is Maxime Lé, and I will be your moderator for today. Je m'appelle Maxime Lé et je serai votre modérateur aujourd'hui. To view who is speaking on Zoom, please put your view on Speaker View instead of Gallery View. The button for this is located on the top right corner of the Zoom video screen. Veuillez changer votre écran au mode Speaker, en anglais, pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de votre écran. Reporters with accessibility needs can pin the interpreters, Andrea and Sarah Ann, or follow along on YouTube. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler les interprètes, Andrea et Sarah Ann, ou suivre la diffusion sur YouTube. Today, we will be hearing remarks from Mayor Jim Watson, from the chair of the Ottawa Board of Health, Councillor Keith Egley, from Medical Officer of Health at Ottawa Public Health, Dr. Vera Etches, and from General Manager of Emergency and Protective Services, Kim Ayotte. Aujourd'hui, nous allons avoir la participation du maire Jim Watson, du président du Conseil de santé d'Ottawa, le conseiller Keith Egley, de la médecin-chef en santé publique à Santé publique Ottawa, Dr. Vera Etches, et du directeur général des services de protection et d'urgence, Kim Ayotte. I will now hand it over to Mayor Watson for opening remarks. Mayor Watson, la parole est à vous.
Well, merci beaucoup. Good afternoon, everyone. Bon après-midi, tout le monde. It's been a difficult start to the new year with Omicron rising exponentially and increasing hospitalizations. And it looks like the next few weeks will be extremely challenging for everyone. I want to assure residents that we will get through this wave of the pandemic and that the city is doing everything possible to mitigate the impacts of this surge and keep people safe. We're taking additional measures to protect the most vulnerable in our community. And we're taking all the necessary steps to maintain essential services in the face of these challenges. On Monday evening, I joined mayors from across Ontario in calling for a return to in-person learning for our youngest residents. The continued yo-yo of in-person and virtual learning cannot continue any longer. Doing so risks detrimental impacts for our kids years beyond the pandemic. And I was pleased to see that the provincial government, just a few moments ago, listened to parents and medical professionals, including medical officers of health, including ours, Dr. Etches, from across Ontario, and announced that they will be reopening schools next Monday. With the return of in-person learning, the city will also be resuming its before and after school programs. Further details will be made available later this week. OPH and the city have taken steps to make schools safer, including prioritizing teachers and education workers to access their first, second, and third doses. Ottawa, along with the rest of the province, has implemented a new public health measure that we continue to make more vaccination appointments available. OPH is encouraging everyone who is eligible to get a booster dose as soon as possible, and Dr. Etches will provide more information on changes to make it easier. Getting vaccinated will protect against severe illness and death associated with COVID-19 and will help slow the spread of this highly transmissible variant. Le nouveau variant est hautement contagieuse et présente de nouvelles menaces pour notre système de santé et pour nos petites entreprises. Je sais que c'est difficile pour tout le monde, mais nous sommes à un moment critique. Vaccinations and the public health measures that we put in place are the best strategy to keep the healthcare system functioning effectively and to protect ourselves, loved ones, and frontline workers. Ottawa residents are doing their part remarkably well, with more than 84% of residents ages 5 and older with 2 doses. Now we're making it even easier to access the vaccine. As of today, all clinics are accepting drop-ins with no booking required for first, second, and booster doses for anyone over 5 years of age. For those who still wish to make an appointment, this week we added 40,000 appointments to the provincial booking system. And I'm also pleased to announce that as of yesterday, over half of the eligible Ottawa residents have received their booster dose. Ottawa residents were leaders and are leaders in getting their first and second doses, and we continue to be one of the top municipalities in Ontario to administer third doses. I want to thank all members of the community who are working day and night to vaccinate Ottawa residents, our hospitals, public health, paramedics, and so many others. For those who still have not gotten their booster, now is the time to do so, and it's never been easier. Both Pfizer and Moderna are safe and can be taken in any combination for your first, second, or third dose. I personally received the Pfizer vaccine for my first 2 doses and the Moderna vaccine on my third. I know this is hard for everyone, but we are at a critical stage and we need to pull together to limit the spread of Omicron. Nous devons arrêter ce variant et nous devons rester optimistes que nous y arriverons. Our community shelter system always sees an increased demand with the arrival of winter weather, and the Omicron variant is impacting shelters and respite centers in Ottawa. The city is working close with public health, Ottawa Intercity Health, and community shelter partners to protect the health and security of everyone and to ensure vital services are maintained, particularly for our most vulnerable citizens. The Tom Brown Arena Respite Center has reverted temporarily to physical distancing center to support and help ease the pressure on community shelters currently experiencing outbreaks. The facility will offer up to 70 beds during the evening and will continue to offer respite services during the day. If you or someone you know needs emergency shelter, please call 311. The past 2 years have been extremely difficult, and this latest surge has been disheartening for many who have done their part to limit the spread of this virus. We need to protect our healthcare system and all essential services, including frontline staff in our grocery stores and pharmacies and everyone providing critical services to our residents and our most vulnerable population. I know how concerned people are with the mental and physical well-being of loved ones, and I want to remind residents that there are people and resources available to help. The Distress Center helpline is available 24/7 to provide crisis management and intervention, emotional support, and other services. You can call the Distress Center. Le numéro de téléphone est 613-238-3311. The number for the Distress Center is 613-238-3311. We are a strong community that supports each other. We see that time and time again. And I want to encourage everyone to help others and continue to support small business owners at this particularly challenging time. Merci beaucoup. Merci beaucoup. Et maintenant, le président du Conseil d'administration pour la santé publique, Keith Egli, Councillor Egli.
Thank you, Mr. Mayor. Hello, bonjour, Quay. Thank you to everyone who has joined this call today and to those who may be watching it live on YouTube. I'd like to begin by talking about the anticipated return to in-person learning for elementary and secondary school students on Monday. We understand that the extended school closure has been challenging for students and their families. We also know that while many people are looking forward to the return to in-person learning, there are also many who are apprehensive about the risk of COVID-19 transmission in schools. Dr. Etches will talk more about that in her remarks. Regardless of whether you're someone who's looking forward to the return to school or someone who's perhaps apprehensive, please try and remember that not everyone is in the same place. Different families face different challenges. With this knowledge, it's important that we be kind and patient with each other, but most importantly, be kind and patient with yourself. We're going through a challenging time right now, but we will get through it. Things will get better. In the meantime, if you haven't already gotten vaccinated or access to your booster shot, please do so as soon as possible. Protect yourself against the risk of severe illness from COVID-19. OPH has recently added thousands of COVID-19 vaccine appointments to the provincial booking system, and drop-in eligibility is quickly expanding. OPH and city staff are working very hard to remove all barriers and increase coverage for all eligible residents. In closing, I could advise that given the rapidly evolving situation with COVID-19 in our community, as chair of the Ottawa Board of Health, I'll be convening a special meeting of the Board of Health on Monday, January the 24th, so that board members can receive an update from Dr. Etches and the team. This will also provide board members with an opportunity to ask questions in a public forum and weigh in on OPH's ongoing response to the pandemic. This will not be a replacement meeting that's scheduled for February the 14th, but rather an additional meeting of the board. Unfortunately, we don't have a clear picture of when this pandemic will end, which can lead to a lot of anxiety for us. The change and uncertainty of the pandemic can be difficult to cope with. Kindness can be a way to find the community's support and hope to help us through these difficult times. I encourage residents to reach out to their friends and neighbors, check in on each other, reconnect either virtually or through outdoor activities. With that, I will now turn it over to Dr. Etches to provide her update.
Well, hello, bonjour, Quay. I do appreciate the mixed reaction to the announcement by the province that in-person learning will resume on Monday, January 17th. The in-person learning is welcome news for many parents and caregivers, but I can understand that others may be concerned. Parents do have many questions. So Ottawa Public Health is working closely with our school boards and our childcare partners. As more information continues to be confirmed by the provincial government, we will make sure we work with our partners to update families and childcare providers. Each family can and should make individual assessments on what will work best for them when it comes to sending their children back to in-person learning. And what everyone can continue to do to decrease the risk of COVID transmission in schools and in childcare settings is to get vaccinated and to stay home when sick. Santé publique Ottawa travaille de près avec les conseils scolaires locaux et partenaires des services de garde. Et dès que plus d'informations est confirmée par le gouvernement provincial, nous allons travailler avec ces partenaires pour la diffuser aux familles et aux fournisseurs de services de garde. Ce que tout le monde peut faire pour réduire le risque de transmission de la COVID-19 dans les écoles et dans les services de garde, c'est d'aller se faire vacciner et de rester à la maison quand vous êtes malade. Ottawa Public Health and partners continue to focus on increasing vaccination rates among children, students, and school staff. And there are many available appointments for people who have not yet been able to receive their vaccine. Please book your child's first or second dose as soon as they are eligible. And for parents, if you haven't done so already, it's not too late to book your vaccine appointments as well. We will be returning to offer school-based immunization clinics for people of all ages in the school community, and especially where people are facing more barriers to vaccination. So people will be notified of these opportunities in their neighborhoods. Nous allons revenir à l'offre des cliniques d'immunisation dans les écoles pour les personnes de tout âge qui font face à des barrières d'accès à la vaccination, et les personnes seront avisées de ces occasions dans leur quartier et leur voisinage. For children aged 5 to 11, the National Advisory Committee on Immunization recommends an 8-week interval between first and second doses, as evidence shows that this schedule produces a stronger and longer-lasting immune response. However, a shorter interval of no less than 21 days has been shown to be safe and effective. So parents who wish to book their child at a shorter interval have the option to do so by calling the provincial booking line at 1-833-943-3900 or by dropping into a community clinic. People will be given a second dose at a shorter interval in our clinics with informed consent. And I think it bears repeating. I know others have said this already, but for people who may find it easier to drop in for a vaccine, Ottawa Public Health and our partners, the city, we're expanding drop-in capacity at community COVID-19 vaccination clinics to everyone eligible, whether it's your first, second, or booster dose. So we will provide daily updates on specific clinic availability on our social media platforms because this could result in some wait times if everyone comes at once. We'll let you know where the wait times are likely to be the shortest. And to reduce the likelihood of lineups, booking an appointment is still recommended and encouraged. In addition to vaccination, we know that schools and childcare have layers of protection that slow transmission compared to other settings. En plus de la vaccination, nous savons que les écoles et les services de garde ont des mesures de protection qui ralentissent la transmission comparé à d'autres établissements. So the layers include daily screening, wearing a well-fitted mask, hand washing, distancing, cohorting, and increased ventilation. Using the online screening tool each day before entering a school or a childcare environment is one of the most important ways to keep COVID-19 out of schools and childcare settings. And the provincial screening tool for COVID-like symptoms has been updated, so I encourage people to check it out this week before heading back to school or attending childcare. Ottawa Public Health will be adapting to the new provincial guidance for schools and childcare, and the province announced today that rapid antigen tests will be available for schools and in childcare settings. We'll also follow the provincial guidance to make PCR home test kits available in schools for symptomatic elementary and secondary students and education staff who become symptomatic while at school. We'll also continue to promote actions and services that can support the mental health and well-being of children. We know this is an ongoing need, and there are resources on our Parenting in Ottawa website and on Facebook. Children's well-being is supported by social connections in school. We know other activities can be important, but prioritizing in-person learning means that higher risk extracurricular activities should still be limited, and emphasis should be placed on outdoor activities for children and for youth, and with a lower number of social contacts. So as the mayor mentioned, residents of all ages in Ottawa do continue to make significant progress getting booster doses, and I want to thank people for that. I strongly recommend all residents eligible for a third dose receive one as soon as possible. There is increasing evidence that immunity can wane over time, and a third dose provides greater protection against severe illness and complications from COVID-19. The evidence is clear that the rates of hospitalization due to Omicron infection are significantly higher in unvaccinated compared to vaccinated populations. Les données sont claires. Le taux d'hospitalisation en raison d'une infection d'Omicron est beaucoup plus haut pour les personnes non vaccinées et plus bas pour les populations vaccinées. And I understand there's some hesitancy from individuals who are concerned about receiving a different brand of vaccine for their third dose, such as getting a Moderna booster shot after a double dose of Pfizer or vice versa. And I want to remind residents, both Pfizer and Moderna are mRNA vaccines. They work the same way, and they are safe and effective. It is safe and effective to use a different brand for your booster. Another question that we're hearing is whether individuals who have recently tested positive for COVID-19 still need a booster, or if they should wait. So let me also be clear on this. People who have previously tested positive or who suspect that they have contracted COVID-19 recently, they should still be vaccinated with a third dose once they've recovered and have completed their isolation and are feeling well. Je veux être clair. Ceux qui ont déjà testé positif pour la COVID-19 ou qui suspectent l'avoir contracté devraient quand même aller se faire vacciner une fois qu'ils ont récupéré de la maladie et qu'ils ont terminé leur auto-isolation et qu'ils se sentent bien. There is no current evidence that suggests that COVID-19 infection provides as much or better protection than a vaccine. So again, there's capacity for first, second, and third doses in our clinic. Please book your appointment or drop in today. And I would like also to speak about something that's on many of our minds, my mind. I've been thinking about for several months, how much longer will this pandemic last? When will these restrictions be lifted? What's next? The Omicron variant is a game changer. Its high transmissibility means we must learn to adapt. As with influenza viruses, we need to protect the most vulnerable populations, such as older people in congregate settings, by vaccinating and by keeping isolated when we are sick. And people need supports, ongoing supports for sick leave to isolate when sick. We know Omicron is spreading very quickly in the community. It's increasing the likelihood that most people may eventually be exposed to it. Nous savons que Omicron se propage très rapidement dans la communauté, augmentant donc la probabilité que la majorité des personnes y seront exposées éventuellement. So the vast majority will be able to weather the illness at home. And people can prepare for this by making sure they have basic supplies on hand and pain relief medication at home. Do seek healthcare assessment for severe symptoms, for chest pain, difficulty breathing, confusion, or rapidly worsening symptoms. Many who are unvaccinated and contract COVID-19, and even some vaccinated individuals, will need hospital care to address the impacts of the related illness. And the health system cannot withstand the pressure of everyone getting COVID-19 at the same time. The hospitals in Ottawa, I know they're working, and they assure me they'll be able to maintain access to critical care. Right now, they are significantly changing how they operate to be able to care for people with COVID and others. Omicron can't be stopped altogether, but we can work to blunt the curve, to blunt that peak, and to slow transmission so that hospitals can maintain the capacity to deliver care. On ne peut pas arrêter Omicron, mais nous pouvons travailler à atténuer le pic et ralentir la transmission pour que nos hôpitaux puissent maintenir leur capacité à pouvoir livrer des soins de santé. So this is an incredibly challenging time, and I'm thankful for your efforts, the efforts of so many that you're making to support each other and encourage each other through it. Thank you, merci, and miigwech.
Thank you, Dr. Etches. Merci beaucoup. We will now hear from General Manager Kim Ayotte. DG Ayotte, c'est à votre tour.
Thank you, Dr. Etches. Good afternoon, everyone. Bon après-midi, tout le monde. Many thanks to everyone for joining us today for this media availability. Since the start of the COVID pandemic, the City of Ottawa has altered its service operations to prevent the spread of COVID-19 and facilitate testing and vaccination efforts, all while safely maintaining essential city services. We achieved this by shifting priorities and redeploying available staff. Since the beginning of the pandemic, staff from recreation, culture, and facility services have been redeployed to assist with testing clinics, vaccination clinics, with respite centers, and this is just an example of many. The strategic deployment of staff is becoming more difficult as city employees, like thousands of other Ottawa residents and millions throughout Canada and around the world, need to stay home because they're sick or have to isolate. Ottawa is not unique to this challenge, nor was it unexpected. We have seen other jurisdictions struggle to provide services to the residents, and I think so far we've been able to stay on top of things here. The City of Ottawa continues to monitor staff absenteeism in all its sectors to ensure essential services are provided to residents at all times. La Ville d'Ottawa continue à surveiller l'absentéisme de ses employés dans tous les secteurs d'activité afin de s'assurer que les services essentiels sont offerts aux résidents en tout temps. For emergency services, we'll continue to respond to emergency calls without interruption. Each of the city's emergency services is proactively deploying resources to deal with absences and to ensure the city remains safe. You can help by calling 911 only for life-threatening emergencies so that our critical resources are available for critical situations. The services are reviewed daily to determine what, if any, steps are needed to take to mitigate impacts. This review is coordinated by our Emergency Operations Center. Locally, there's been minimal impact to the public due to city staff illnesses or isolation. However, this could change. If there are impacts to city services, the city will communicate with residents to make sure that you're aware of how they are affected. S'il venait y avoir des répercussions sur les services municipaux, la Ville communiquera avec les résidents pour s'assurer que ces derniers sont au courant des effets de les modifications de services. I encourage residents to follow City of Ottawa on Facebook, Twitter, download the City of Ottawa app on Android or for Android and Apple mobile devices to stay up to date on the services that could be affected. You can subscribe on ottawa.ca and our e-alerts to receive email about service disruptions. You can follow OC Transpo on Twitter and sign up for their alerts to stay informed about service changes that could affect you. You can download City Waste collection app to find out if there are any delays in your neighborhood. Vous pouvez également télécharger l'application Calendrier Collecte Ottawa pour rester à l'affût du changement de la collection de déchets pour votre voisinage. Clients of our city-run childcare centers and long-term care homes will be contacted directly if there are any changes to the scheduling or policies of these centers. As the Mayor mentioned, with the arrival of winter weather, our community shelter system always sees an increase in demand. And now that the COVID-19 Omicron variant is widely in our city, it's also impacting shelters and respite centers in Ottawa. I want to remind everyone that people who are in urgent need of shelters can call 311 or have someone call 311 on their behalf for assistance, where the city can assess their needs and provide support accordingly. Je tiens à rappeler à tous les résidents qui ont besoin d'un refuge d'urgence qu'ils peuvent téléphoner au 311 pour obtenir de l'aide. La Ville pourra évaluer leurs besoins et leur fournir un soutien adéquat. As a final message as the General Manager of Emergency and Protective Services, I often remind people to prepare for emergencies by having enough food and water in your emergency kit to sustain everyone in your family for 72 hours. Today, my reminder is a bit different. It's to prepare to isolate. You should have enough supplies in your home to support your family for at least a 5-day isolation. As many of you have learned, the call to isolate the entire household can come suddenly and unexpectedly. We need to continue to work together to keep our community and our residents safe and healthy. Nous devons continuer à travailler ensemble pour s'assurer de la sécurité et la santé de nos résidents et de notre communauté. Thank you. Merci.
Thank you, GM Ayotte. Merci beaucoup. I'll now invite each media agency in reverse alphabetical order to ask their questions. Please remember that you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique inversé. Chacun pourra poser une question ainsi qu'une question de suivi. Cela étant dit, nous allons commencer avec Radio-Canada, Frédéric Pépin. Frédéric, c'est à vous.
Oui, bonjour tout le monde. Première question à vous, Dr. Etches. Pour ce qui est du retour à l'école, est-ce que ça vous inquiète, là, le retour à l'école des enfants et le taux de vaccination des jeunes de 5 à 11 ans? Et comment est-ce qu'on peut s'assurer qu'on convainc un plus grand nombre possible d'enfants de se faire vacciner?
Je voudrais que toute la population entre 5 ans et 11 ans va avoir la protection d'une vaccination contre la COVID-19. Avec les adultes, c'est clair, c'est la vaccination qui diminue le risque d'hospitalisation. Mais pour les enfants entre 5 et 11 ans, le risque d'hospitalisation, c'est tellement plus bas, mais les vaccins aident avec la diminution de risque dans cette population aussi. Alors, c'est important et je voudrais dire merci à tous les étudiants qui ont fait la vaccination parce que c'est la majorité à Ottawa. Nous avons plus de 64% de cette population vaccinée maintenant et le taux continue d'augmenter. Je voudrais voir plus de gens dans cette groupe d'âge aller à notre clinique parce que maintenant c'est plus facile. On n'a pas besoin d'un rendez-vous. Et on va continuer aussi de travailler fort, d'aider les gens dans les quartiers avec moins d'avantages ou peut-être la transportation, c'est difficile. On a besoin d'informations dans différentes langues. Nous avons une équipe tellement concentrée sur la population où le taux de vaccination est plus bas.
Madame Etches, si je peux vous demander aussi par rapport à les cliniques de vaccination, vous dites maintenant que tout le monde peut s'y rendre pour première, deuxième ou troisième dose sans rendez-vous. C'est bien ça? Tout le monde peut juste aller à leur plus proche clinique de vaccination?
Oui, c'est un grand changement, je sais, parce que la semaine passée, la fin de semaine passée, c'était une situation où il n'y a pas de rendez-vous, tout est bloqué, mais cette semaine, non, il y a des rendez-vous disponibles. Parce que l'équipe avec Kim et son équipe, ils ont travaillé fort d'avoir plus d'immunisateurs, plus de rendez-vous, et c'est la population peut-être qui n'a pas complètement, je ne sais pas si absorbé, c'est un mot en français, mais peut-être apprécié l'importance de cette protection avec une troisième dose. C'est clair, le 2, c'est bon d'aider, d'éviter l'hospitalisation, mais le troisième fait une grande différence. Et c'est pourquoi on a l'espace dans la clinique, on veut que c'est utilisé vite chaque jour. aujourd'hui, demain. Le truc, peut-être, c'est si tout le monde arrive à une fois, alors c'est pourquoi on demande encore si vous pouvez faire un rendez-vous, parce que ça aide de diminuer les coûts.
Okay, thank you very much. Merci beaucoup. Next up, we have the Ottawa Sun, Joanne Lausches. Joanne, over to you.
Hello, can you hear me?
Yes.
Can you hear me? Okay, great. This is a question for Dr. Exes. Starting today, Ontario is starting to report hospitalization according to people who are hospitalized for COVID, as well as those who are hospitalized with COVID. Can you give me some sort of perspective on the level of people with COVID in Ottawa hospitals right now and how that is affecting hospital capacity?
Yes, so I think we're working to try to make this clearer, with our hospital partners that we do look at hospitalizations differently for different reasons. So the way I think about it is hospitals need to know about everyone in their hospital who's tested positive, because they treat people who are positive for COVID with isolation precautions. And there's different staffing implications, and they need to know all this information to run the hospitals. The hospitals will have people who are suspect COVID patients as well, because they have respiratory symptoms, but the lab results haven't come back yet. So the hospitals have a larger number of people that have tested positive, that they're counting the suspect cases, than what we want to know as public health, which is how often is a new severe illness due to COVID presenting? So it's the difference between measuring the prevalence of COVID in the population of people in hospital and the incidence, which is the new counts. So on our dashboard, we have the new counts of people testing positive who require active treatment in hospital. And it is much less right now. So I know that the hospitals are providing their numbers for their count for what's inside the hospital. And our count comes from following a provincial definition for those new hospitalizations. Because the volume's going up, we are looking to see if we can speed up some of the data entry processes to make sure we're right on top of this in terms of being able to follow the trend. But because public health has measured the hospitalizations the same way through the whole pandemic, our trend line in the hospitalizations is useful. It tells us, what's happening compared to before, and we'll continue to follow that as a good indicator of how much is in the community. So I think that, the hospitalizations, there's other nuances there. They are going to be distinguishing between who's in to be receiving treatment for COVID and who's in and testing positive. Again, that's helpful because it gives us a better sense of how much severe COVID is out there, the people requiring treatment, and that percentage, of the overall amount of COVID in the community will end up being severe. And so it's kind of, again, an indicator of how much COVID is in the community compared to just measuring anybody who tested positive. I hope that helps, and know that we are trying to make this clearer to people why we measure different things and what they tell us.
And for my follow-up question, can you tell me if anywhere in this process the numbers capture the number of, or anyone captures the number of infections that are acquired while in hospital?
Yes, that typically could be discerned because we look at outbreaks in hospital settings. Our team is part of the discussion. Anytime there's transmission of COVID in a hospital that could be outbreak and outbreak related, then that is what we assess, and that's reported on our website. So you find that information in the hospital outbreak reports.
Thank you.
Thank you very much. Next up, we have the Ottawa Citizen, Elizabeth Payne. Elizabeth, over to you.
Thank you very much. Dr. Etch, is a question for you as well. It's to do with wastewater. I understand there are signs that it is leveling off. Wondering if you can comment on that and talk about what else we are seeing that might give you a sense of whether we're hitting the peak or any way of knowing when the peak might be in Ottawa.
Yes, I, of course, would love to see a very clear peak and a decrease of COVID in our community, just like everyone else. And so I do watch the wastewater because it's one of our earliest indicators. It measures just 91% of our community and whether they're shedding virus. And it does look like some of the measures there are decreasing just slightly, but we see sometimes they can go up and down, right? So you could never really call a trend on a couple of days worth of data. So the other things we're looking at are the hospitalizations. The wastewater scientists have seen that hospitalizations tend to drop about 5 days after the wastewater starts to drop. So we'll be looking for that. I think the measures that the provincial government put into place, I believe it was January 3rd, this is about the time that we could start to see that they might be having some impact. So, this week, those measures were able to slow the transmission of COVID, then that would be good to see that. I would say it's unpredictable with Omicron because it is so transmissible. It still has many people in our community that it can reach. And because it's still infecting people who are vaccinated, that's a lot of people in Ottawa where we could still see ongoing transmission, given its high transmissibility. But again, if we can slow that, it helps our hospitals. So that proportion that needs treatment for severe illness doesn't arrive all at once.
Thank you. And follow up?
Yeah, thanks very much. For Mr. Ayotte, I'm wondering if you can help with some more details about services and how they might be affected in the city by people off sick and isolating. First of all, have there been any in garbage like that, problems with the paramedic service? And is one of the mitigation features, do you have a work isolation program so people who are isolating and so forth can go back to work to fill those gaps?
Yes, thank you for that, Elizabeth. Overall, I think our service levels are good. We continue to maintain them. We do shift things around and we do call in overtime to cover off the need. With regards to our paramedic service, there's various functions various factors that affect, you've read in the media level zeros, et cetera. A lot of that is based on offload delays, increases in call volume. But I can tell you that the number of paramedics we have on the road continues to be stable. And so that's not the deciding factor. So there hasn't been a decrease in the number of paramedics on the road. So I can assure you of that. Same with our fire service. With regards to waste, I know there was something came out right after Christmas where our waste collection services identified certain neighborhoods that would receive delayed waste collection. Well, that was as a result of the quantity of waste we usually get at this time of year and not necessarily COVID related. However, there always are minor factors of COVID in it. So there was some indication that there may have been a delay as a result of COVID, but in fact, it was simply the time of year and the area that we were in. So it wasn't really a service disruption, especially not a wide one. So very minor in nature. And sorry, you had a third component you wanted to know about. Work isolation policies, et cetera. Yeah, we do have a work isolation policy, and that's for people who are not COVID positive, who are asymptomatic. They can be brought back to work only if they're high risk contacts and if they test negative with either a rapid antigen test or a PCR test. And now we're looking at essential services only for those. So we're not bringing everyone back to work. It's very specific to emergency services and very high level essential services. I can report that the only service that's actually used that I'm aware of at this point in time is the paramedic service. And again, it's for non-positive paramedics who are high-risk contacts who have been tested, and they're brought back in. And then when they are brought back in, there are very specific criteria for which they work in. And so at this point in time, touch wood, we seem to be doing well. However, that can change overnight with Omicron. You never know. So we have contingency plans in place, and we will notify our city mayor and council and the media if any service disruptions are expected in the near future.
All right. Thank you.
Thank you very much. Nous allons maintenant procéder avec le journal Le Droit avec Jean-François Dugas. Jean-François, c'est à vous.
Oui, bonjour Mme Mathias. Je me demandais, je parlais aujourd'hui avec une directrice générale d'une garderie qui disait que les vaccins, ou pas les vaccins, mais les tests rapides sont vraiment juste réservés à les employés qui ne sont pas vaccinés, tandis que ceux qui sont vaccinés n'ont pas accès à des tests rapides. Puis elle se demandait, parce qu'au Québec, c'est sûr que les agences sont reconnues comme des services essentiels, mais ce n'est pas le cas en Ontario. Donc, est-ce qu'il y a comme une négociation qui se fait avec le gouvernement pour leur permettre d'avoir plus accès comme ça à des tests rapides parce que pour un peu qu'il y ait moins d'anxiété et les aider à cheminer là-dedans?
Absolument. C'est une population, les enfants et les travailleurs dans le service de garde où je pense c'est important d'avoir accès au dépistage et c'est quelque chose que le gouvernement a annoncé aujourd'hui. Okay. Alors, le ministre de l'Éducation, Stephen Lecce, a mentionné aujourd'hui, cet après-midi, juste avant maintenant, que l'accès au dépistage rapide, c'est pour les enfants aussi. Dans les services de garde. Mais pour début, je pense que c'est 2 dépistages pour chaque enfant. Et je pense que j'ai entendu le plan, c'est d'avoir distribution chaque semaine ou une quantité qui continue d'être là avec la livraison de la gouvernement fédéral.
Okay. Non, j'ai peut-être mal exprimé. C'est plus pour les employés, comme les éducateurs, eux autres, ils n'ont pas accès. Les employés des garderies, là, eux autres, c'est juste ceux que je pense qui ne sont pas vaccinés qui peuvent avoir des tests. C'est ça qu'elle me disait, là? Je ne sais pas si c'est...
Je vais besoin de vérifier. J'ai pensé que c'était pour les enfants aussi avec des symptômes. Comme le même que les écoles. Je trouve que le gouvernement provincial maintenant traite les services de garde et les écoles plus le même. Pour la distribution des masques et le dépistage. Mais oui, je peux vérifier.
Okay. Puis, comme deuxième question, je me demandais, autant vous, Mme Mathias, que M. Watson, qui a disparu, mais je voulais savoir, hier, il y a eu...
Salut, JF.
Bonjour. Il y a eu comme une mini-bombe qui a été lancée hier par le premier ministre du Québec par rapport à taxer les non-vaccinés. Je me demandais si vous avez des impressions, commentaires sur cette décision-là. C'est quelque chose qu'on pourrait peut-être voir en Ontario ou à Ottawa, ou je ne sais pas, mais que pensez-vous de cette annonce-là hier?
Alors, peut-être je vais commencer, Dr. Etches. Non, je ne suis pas d'accord avec la proposition du Premier ministre Legault. Je ne pense pas que ça, c'est une bonne idée. C'est presque impossible les logistiques de faire ça, et je pense que c'est meilleur si on travaillait avec des personnes qui n'avaient pas des vaccins, de convaincre des personnes d'accepter un vaccin, pas donner une autre taxe.
Pour moi, c'est aussi une question de valeur que le droit de soins de santé, c'est là. C'est un droit d'avoir accès aux soins de santé et de créer des barrières. C'est peut-être problématique, c'est inéquitable peut-être aussi. Alors, ce n'est pas ma recommandation. C'est important de continuer d'augmenter le taux de vaccination par les méthodes de comprendre les défis pour les gens, de comprendre leur compréhension concernant la valeur des vaccins. Et on continue ce travail. C'est un message aujourd'hui. C'est pas trop tard d'avoir une première dose. C'est utile.
Merci.
Merci beaucoup. Next up, we will go to CTV News Ottawa with Josh Pringle. Josh, over to you.
Thank you very much and good afternoon. My first question is to Dr. Etches and also to Mayor Jim Watson, if you'd like to comment. The Quebec government announced this week that they'll be imposing or considering imposing a tax on the unvaccinated. Do you support such an initiative to encourage the remaining 10-15% of people to roll up their sleeves and get the vaccine, or is there other things we can be doing instead?
Yeah, maybe I'll start again, Doctor, and we'll ask you for your comment. Yeah, I don't support what the Premier of Quebec has proposed. I think there are logistical challenges with it. I would rather work with those people who are unvaccinated to continue to convince them of the merits of vaccination, as opposed to sending them a bigger tax bill at the end of the day. I know it's frustrating for those people who are following the rules and respecting the rules and getting their second shot and booster, but I'm not sure whether it's even legal what he's proposing. And I would rather us use a carrot as opposed to a stick and encourage people to get their vaccination, because at the end of the day, it's in their self-interest to help protect themselves and their loved ones. Doctor?
Yes, I do think it's important to recognize the value of access to healthcare being a right, and something that we do prioritize in Canada. And so to me, it would be problematic to create barriers to healthcare for people. And absolutely, it's important to continue to try to increase our vaccination coverage, to understand why people aren't vaccinated, to help overcome the challenges, misinformation, and that's what we're continuing to do. So I'm really thankful that there are people coming forward still for first doses. And again, today, this is part of what I'm asking people to do, to understand with high levels of Omicron, the vaccination is really important protection against hospitalization and death.
Thank you. My second question is for you, Dr. Etches. Today, Ontario announced that the new threshold to notify people of COVID-19 outbreaks in schools is 30% of students absent. Now, you said earlier today that it's increasing likelihood that most people will be exposed to Omicron. What do you say to parents who will see that and also find out that it will be only when like 200 people are absent in a school of 700 people that you'll be notified that there's potentially a COVID outbreak in schools? And how should they feel safe that sending their kids to school is the right thing to do?
Well, I think the level of Omicron, it is a reality that it's high right now in our community. And so what we've seen over the course of the pandemic is the rates in the community are what can then be reflected in schools. However, the measures in schools have led to less transmission in school-based settings compared to in the community. So to really focus on what's in our control, there are ways we can limit COVID transmission in schools, starting with vaccination, using the high-quality masks. We know staying home when you're sick, using that screening tool every day is important. So I am sure that word will get around when people are staying home when they're sick, and before we reach a 30% threshold, that people are being asked to notify their close contacts if they test positive for COVID. So if they're using these rapid antigen tests that are available for students, letting their close contacts know that they have turned positive. I mean, that will be some information for parents. I think what hasn't really been clear is that the management of the situation doesn't change whether or not someone has confirmed tested positive. So let me go over that. If somebody in a classroom tests positive, the advice to everyone else in that classroom is to monitor symptoms for 10 days. That's the advice to contacts in a classroom. Monitor for symptoms for 10 days. If somebody in a classroom is sick and goes home, the actions that people in that classroom should still be taking is every day before they go to school to monitor for symptoms. So it actually doesn't change the management in the school, whether someone's confirmed with Omicron with a test or homesick. So I think that, we will be looking for patterns and monitoring, what is happening across the school age population that is being tested with PCR tests. We'll be looking, and monitoring. We'll be following hospitalizations, although they've been very limited in number, informing parents about what we see in the community. Because again, it's the community levels that really end up being reflected in schools.
Thank you.
Thank you very much. Next up, we go to Ctv News Ottawa with Deborah Ryder. Deborah, over to you.
Hi, good afternoon. My question is for Dr. Etches with regards to school-age children between 5 and 11. What is Ottawa Public Health's percentage of vaccinations that you're aiming for in the next 4 days before students actually return to classroom in-class learning?
Thank you. I will just pull up the graph that shows our current coverage rates, which is available to the public on our vaccination dashboard. Our team would like to see the same coverage rates in the 5 to 11 population as for what we've achieved between 12 and 17. We know this is a safe and effective vaccine. There are rare side effects that have been reported in younger adults and older children, like myocarditis. We haven't seen that in the 5 to 11-year-old population at all. So this is a vaccine that is safe and effective, can provide decreased risk of hospitalization if children encounter Omicron. It's worth it. I'm not sure how parents are interpreting the difference between the under 12 and the over 12, because we've achieved 94% of people between 12 and 17 are vaccinated with a first dose, 89% with a second dose. So we have a little ways to go when we're at 64% with a first dose for the 5 to 11s. So I would like to see that come up. I'd like to see it get over 70% and higher. And that's what we're focused on, it by advertising drop-in options for people now. They can drop in if they're in that age group, actually any age group, but the appointments give you a secure time. You can show up at that time if that's easier for you to have predictability. There are neighborhood-based vaccination hubs still operating, and we are going to go into schools, also just to continue to give many different options to families. Again, using different languages, using staff who understand different cultural backgrounds and can answer questions in people's first language. These are all things that the team's focused on right now.
Okay. So my second question is to you, Dr. Etches. Again, thank you. Can you walk me through the steps of what you're expecting, what parents should expect when they're physically taking their kids to school who are 5 to 11? And once they enter the school environment, what is expected of them walking into the school to keep it as sterile as possible?
Thank you. Before heading out the door to school, what I'd like to see all families do is use the Provincial screening tool online. It asks children if they have any risk factors for being positive for COVID and any symptoms that could be COVID. If people do test on that screening tool, fall into a category where they should stay home, to follow that advice. And if staying home with an ill child is hard because of financial strain or other reasons, I want people to know that the city can help with emergency social services support if it reaches that kind of challenge. We need to help each other to be able to stay home when we're sick, and also let people know what kind of sick supports are available, sick leave, employers being flexible. We really need to help each other through this month by being understanding. Then if you're past the screening test and you're on your way to school, please make sure you're wearing a good quality mask. And that would be something that fits well. It has at least 3 layers. If you don't have a mask like that, schools are going to have some masks for children that are higher quality. And so that would be something that the child could indicate, or a parent could indicate to the school that they would like to have a mask. I don't know the operational ways that schools are going to distribute those masks, but that will be an option. Would ask that the children, as they have done, I mean, children and youth have done so much. They've worked so hard with their teachers, with their educators, to try to stay to their cohorts, right? So that group that they're with for education, outside at recess, I know they're still trying to keep cohorts together, because even that close contact outdoors with a more highly transmissible virus, we can expect we want to try to decrease those options for transmission between groups. Similarly, where children are going to take off their masks to eat, paying attention to stay that distance that you can from others while you're eating with your masks off. All of these things help. None of them are perfect, but the different layers of protection do decrease transmission. Along with that, we know the schools are trying to keep doors and windows open, use ventilation where they can. So I think, there's nothing, I don't think there's anything else physically different. The schools would be best able to speak to what they're planning to do, but they are going to still be limiting, extracurricular activities that are high risk, school assemblies, these kinds of places where people would come into close contact. They're really still working hard to limit those.
Thank you. I appreciate your time.
Thank you very much. Next up, we have CBC Ottawa, Guy Quenville. Guy, over to you.
Hi, can you hear me?
Yes, we can.
Thank you for your time and for the questions. First is for Dr. Etches. You mentioned earlier a lot of parents are relieved that they'll be able to send their kids back in person to school. Others are more mixed. And just a few moments ago or earlier this afternoon, the province laid out some new additional things they said they're doing to help assuage those worried parents, like more N95s, HEPA filters, rats, and school-based clinics. My question is, when you look at what new things they're doing, is there anything else that OPH asked or has suggested to the province that it do to make schools safe that hasn't been announced today or in recent days? And if so, why do you think it's important for them to also take that additional step?
I think the province is on the right track to continue to bolster, the measures that have been shown to help with decreasing transmission in schools. So, continuing to focus on ventilation and the cohorting and the quality of masks, and also, of course, the screening before people go and the vaccination before people go. These are all the key elements, as well as I think the ability of staff to stay home when they're sick. This is something I was meeting with the unions earlier this week from schools and the school boards, and hearing again, we need to help educators understand they may feel concerned about the workload they're leaving if they stay home when they're sick, putting more burden on their colleagues. But this is the time to stay home when sick, and so really being able to support colleagues in that way, I think, would be another thing that we're seeing locally that people are concentrating on. Does that answer your question?
Yeah, I'll switch gears for my follow-up. This is for you as well, Dr. Etches. Dr. Moore, just earlier this afternoon, was asked about the notion of mandating vaccines in kids aged 5 to 11, I guess, as it means to improve the uptake in that age group. And he answered that he thought the vaccines in kids is still too new a thing for that to be to his liking. But I wanted to ask you for your thoughts on the notion of mandating vaccines for kids, any concerns or other thoughts you have on that idea.
I want to be very clear that we have good information about the safety and effectiveness of the pediatric vaccine. It's the pediatric Pfizer dose. It's been studied to be safe and effective, and now we have real world use of this vaccine in millions and millions of children. And as I said earlier, we have not seen those serious but rare side effects. So I don't have any concerns about the safety and effectiveness of the vaccine based on the studies and the real world experience. I think where the policy decision comes, it also would need to be the case that everyone's had a chance to be vaccinated before you require something. So I can understand that we're still in a period where we're still offering the vaccine to children 5 to 11. So if it was made required tomorrow in Ottawa, we still have 37-ish% of the population that wouldn't be able to be present in schools because they haven't been vaccinated. But that we hope is changing quickly, and we'll keep working on that. Where I have said I'm interested in things going in the longer run is to use the Immunization of School Pupils Act to include COVID-19 vaccination, because that is an effective tool we have to be able to look at the vaccination rates in students. The Immunization of School Pupil Act is used for other vaccines like measles and mumps and tetanus and and so we need to be able to, when there is an outbreak, say, of measles, then understand who do we need to exclude because they're not vaccinated. So it's a tool that gives us good information and would be something that we would like to see in the longer run.
Thank you very much. Our last question comes from the Barrhaven Independent, Charlie Sinek. Charlie, over to you. Are you still here? Okay, well, it does not appear that they are here. In this case, well, that's all the time we have for today. C'est tout le temps que nous disposons aujourd'hui. Thank you for being here with us, and merci beaucoup. See you next time.
Thank you. Merci. Bye.